Jessica Dufault here at Mindful Motion Physical Therapy, and I have specialty training in both pelvic health and obstetrics. And I'd like to take an opportunity to talk to you today about diastasis recti. And so we tend to see a lot of women here in our clinic. We get a lot of referrals for this condition. And I think it's really amazing that healthcare providers and women are both screening for diastasis and then really taking an opportunity to address it and work on it and heal it. And I think that's really important. However, because this is such a talked about condition at this point in time, I think there's a lot of misinformation about diastasis, as well as almost fear around having this condition and living with it and working towards healing it. And so there's a couple of concerns that pop up pretty regularly among healthcare providers that we interact with, as well as clients. So I thought I'd kind of address those as we go here today. So the first and the most important thing I think that I can put out there is the fact that diastasis recti is a physiologically normal process. Okay, so this should be happening as baby grows. So if you think about the superficial layer of abdominal muscles, you have a right and a left half, and then it's connected right here through the linea alba, or what's known as just a fascial band that keeps the pieces together. Well, as baby grows, that fascial band needs to release in order to make room for baby. Okay, so it's a good thing that this happens, and we welcome it in order to have the space that we need for a healthy pregnancy. So that's the first thing that I just like. If you have one takeaway today, is diastasis recti is a normal physiologic process. Most women during third trimester and postpartum are going to experience some form of abdominal separation. The second thing I'd like to talk about is that there's a lot of talk about how this has to close in order for us to feel strong, to feel healthy, and to look good. And that's actually, in fact, not the case. And so one of the things that we talk a lot about is that you can still have a diastasis, whether it's this much or this much or this much. The only thing that we need to address is your ability to bring tension across right to left between those two muscle fibers, okay? So that we can transfer load and forces through appropriate forces through our abdominals. Okay, so if this piece in the middle is kind of loosey-goosey, then that's a problem. More if the concern is, can we generate tension, not necessarily close? And so I think coming in with a goal to close diastasis may in some cases be unreasonable, but the good news is that we can improve function, you can eliminate symptoms, and it can potentially even look better if there's some tension across that linea alba. Okay, and then another question I get a lot is, okay, I have diastasis. What are all the things I should avoid? And so you could Google exercises to avoid if you have diastasis, and you're going to get all sorts of answers. Okay, and I think this does a disservice to women, because some women may be able to do certain exercises that other women cannot. And so to blanket statement say don't do planks or don't do burpees or don't do a crunch or a sit-up is a really bad idea. But when we look at, so there was a consensus statement that was put out by 28 of the top physiotherapists in Canada, and the things they agreed on were this about exercise and diastasis is any technique where you are breath holding is a really bad idea. So let's just imagine postpartum, you're constipated and you're bearing down. That Valsalva maneuver is a really bad idea. That's too much intra-abdominal pressure for a system that has a little bit of diastasis, okay? Maybe if you've returned to weightlifting, if you have to hold your breath in order to get your weight where you're wanting it, that's a bad strategy if you have diastasis. So anything where you can't breathe properly would be something to avoid. And then the next really general statement is we want to avoid doming. And so that's essentially where, you do an exercise where the load is too high, and then you get this kind of pop-up of your superficial abdominals, and we want to avoid that doming. So, if you're working with a trainer or a physical therapist, these are the things that we can help guide you on in order to make sure that whatever load you're putting through your core can be sustained. And so that's really important thing to understand. And the last thing I'd like to say is it's never too late to work on diastasis. I see women in their 50s and their 60s who were, for the first time, diagnosing diastasis and addressing it. Here's the thing. We know that the critical healing period is in the 4th trimester. However, we can make changes to function at any point in time. So it's never too late to seek treatment for diastasis. And, also as a side note, it's important to understand that after cessation of breastfeeding, so up to 4 months after cessation of breastfeeding, you can get continued improvement of diastasis. So there's a couple of really important points to think about as you are going through healing of this condition. And if there are any questions or thoughts, anybody want to throw anything else in here to talk about, I'd be happy to do that, because it's a topic that I'm really passionate about, and want to make sure that all women are getting the support that they need. Thank you.